Good morning, everyone. My name is Veronica Morrow, and I would like to welcome you to the second of two customer calls that have been planned for FY24. I'm a member of the Behavioral Health Services team for FOH and will be the facilitator and moderator for today's call. Before we get started, I'd like to review a few housekeeping items which you should be aware of. This event is being recorded. A copy of the recording shall be shared with all invitees at the conclusion of the meeting and posted on the HHS YouTube page. The chat, mic, and video features are currently disabled for attendees. For any attendees who would like to utilize the transcript feature, that can be accessed by clicking on the Show Transcript option. The Show Transcript option can be found by clicking on the More at the top of the screen, then selecting the Record Transcript option from the drop-down menu. Please hold all questions until the end of the presentation, when the chat feature will be enabled so that you can pose your questions and we can provide some answers. Next slide, please. The agenda for today's call is as follows. We will begin with opening remarks by PSC Director, Ms. Melissa Bruce, followed by a warm welcome by FOH Director, Dr. Sheila Robinson. Following these two speakers, we will have specific programs updates from the different FOH service areas: behavioral health services, environmental health services, wellness and health promotion services, and finally, clinical health services. Subsequently, there will be a moderated question and answer session following closing remarks, followed by closing remarks. Without further ado, I would like to welcome our esteemed PSC Director, Ms. Melissa Bruce, for opening remarks. Ms. Bruce?
Thank you, Ronnie. Good morning, everyone. Thank you all for joining our Federal Occupational Health Customer Engagement Meeting and for your continued partnership with us. Again, I'm Melissa Bruce, the new PSC Director. I would also like to introduce Connie Yates, the new PSC Deputy Director. Connie, would you like to say hello?
Good morning, everyone. It's great to be with you this morning.
We are both happy to be here with you today. A little bit about myself. I've had the opportunity to serve at both the Department of the Treasury and the Department of Homeland Security in various capacities, including budget and financial management, information technology, human capital management, employee engagement, policy development, and facilities and logistics. Additionally, I've directed and implemented shared services programs in alignment with business objectives and strategic priorities within the government. I am thrilled to be at PSC to ensure we continue to provide higher value service delivery that meets and exceeds your expectations. I'm excited about the service updates and improvements that you'll hear about today, which are aimed at enhancing your experience with us. The FOH team is kicking off our FY25 interagency agreement cycle this week, and they're prepared to work with you in completing your IAAs. I would like to stress the importance of completing and returning these IAAs as soon as possible, because this helps us plan the level of support and services you require from us next year. It also impacts the amount of funding FOH may receive at the beginning of FY25 to provide these services. So please continue to partner with us to finalize the FY25 IAAs as soon as possible and to also have a successful FY24 closeout. Our priority continues to be putting our customers, all of you, at the center of everything we do. Thank you for your time today and your trust in us. Dr. Robinson, thanks for inviting Connie and me to be here. Now I'll turn it over to you. Thank you.
Well, thank you, Melissa and Connie, for taking time to join the customer engagement call today and for welcoming our customer partners. As you can see, it's important for leadership to be seen and for them to understand that you support what we're trying to do. So again, thank you guys for taking time to be with us today. Happy Wednesday, everyone, and thank you all for joining us today. Again, I'm Sheila Robinson. I'm the director of FOH, the FOH portfolio. And we're excited to hold this customer call today to provide updates, share some information about what's going on in FOH, to answer any questions you may have, and also to solicit feedback on how FOH can continue to be a viable partner with your agency. Now, as I mentioned on the last customer engagement call in February, FOH is working towards improving operations and processes. I would like to thank everyone in advance for embracing these changes as we strive to rebrand FOH and also move forward into the 21st century. Again, I am sincerely excited to lead this FOH team and to serve you, our customer partners. I know that FOH team is committed to ensuring that we meet your needs, as well as striving to deliver outstanding customer service and support. Next slide, please. Now, as you know, FOH operates as a shared service provider for occupational health services, as we operate under the authority of HHS Services and Supply Fund, which is kind of equivalent to a working capital fund. Now, this slide provides additional details of the FOH program and the policy for which FOH's shared services statutory authority is derived from, which is 42 USC 231. We get asked a lot who gives us authority to provide our services. So therefore, as a shared service provider, we cover the cost of our provided services through the interagency agreements, through IAAs with you, our customer partners. That's why it is so important that we get these IAAs finalized as early as possible in the fiscal year so that we can move forward with getting the funding we need to provide the services to you, our customer. Next slide. So before we get started with the presentations, I again want to introduce or reintroduce the FOH leadership team. So today on the call, you're joined by Ms. Betsy Emelin, the Acting Director of Behavioral Health Services, BHS. Now, she oversees our EAP and our work-life programs. We also have Mr. Keith Kirkpatrick, the Director of the Environmental Health and Safety Program. He oversees the development and implementation of job safety and health centers as outlined by OSHA. We also have on the call Mr. John King. He's the Director of the Wellness, Health, and Promotion Services, and he oversees our related physical activities and healthier lifestyle programs. We have Dr. Bamalu, who is the Director of Clinical Health Services. And of course, she oversees the catalog of FOH services to include our on-site clinics, our medical employability programs, and many, many more clinical services. You also have met when we are joined by Ms. Catherine Chin. She's our FOH Director of Operations and Management, and she oversees our agreements and physical team, and also as well as our contracts and our HR services. And rounding out our leadership team, we are also joined by Dr. Michelle Smith-Jeffries. She's our FOH Medical Director, and she provides the medical oversight of FOH programs and practicing providers. And last but not least, you will meet and have met Ms. Tia Harrison. She's the FOH's Chief Technology Officer, and she oversees and manages FOH's IT systems and technological support. I am extremely proud, again, to introduce you to the FOH leadership team. We finally got everybody on board, and they have been working hard these nice months that I have been here. And we want to thank you, and I know they are proud of the services that they're trying to provide to you, our customers, partners. Next slide. So again, I asked our members of our FOH leadership team to provide a brief update and overview of their service areas, and also highlight any significant updates they would like to share with you today. So we will begin with our Acting Director of BHS, Ms. Betsy. The floor is yours. Next slide, please.
Good morning, and thank you, Dr. Robinson. Greetings from the entire BHS team. We are proud to share some significant enhancements that occurred in this fiscal year, as well as give you a glimpse of what to come in the new fiscal year. Operationally, we have employed a clinical-first care center. Our care center remains available 24 hours, 7 days a week, all year round. When you call the National Care Center at 800-222-0364, your calls are answered by a licensed mental health professional. Our clinical first answer model allows callers to speak with a mental health professional immediately. They will engage the employee in an assessment to determine what their needs are. They also will screen for any risk and assist the caller in getting connected to a provider for a virtual face-to-face appointment. The work-life assessment remains unchanged. Now remember, your agency must have purchased the work-life benefits from FOH. For callers seeking work-life services, the mental health professionals who answer the phone will warm transfer you to a work-life specialist who has experience in the desired areas of support, such as dependent care, daily living services, geriatric care, and emergency backup care. The work-life specialist will engage in a comprehensive assessment of your needs and identify referrals to address the concerns presented. Next slide, please. We have updated the FOH for You website. This is our EAP website that customers find valuable information, educational materials, resources, and self-assessments to help employees address personal and work-related issues pertaining to one's overall well-being. For those who have not visited the website, FOH has introduced a few new tiles. To ease navigation for our agency partners who have the bundle agreement that includes EAP and work-life services, the Work Life for You service tile is now featured on the FOH for You website. To access the Work Life for You resources, agencies still will need to enter the registration code to view the Work Life resources or enter your username and password if you have previously established an account. We have enhanced our customer partner experience by adding the What to Expect tile, which offers a detailed overview of what happens when you make the call to the 800 number. Here's where you'll learn what happens when you contact the National Call Center number, as also where you can find answers to frequently asked questions like, is my information protected? Where are the counselor's office located? And how long does it take to get an appointment? While we are here, I would like to address the last frequently asked question. Our goal is to schedule an employee with someone while they are on the phone. If an appointment is not available, an employee can view our counselors online and reach out to them or request an appointment search, which can take up to 1 week. If for some reason an employee is unable to successfully schedule an appointment or don't hear back from our provider within 5 business days, please call us back at the 1-800-222-0364. We will provide assistance for appointment search. To be clear, this is how long it takes to schedule an appointment. The actual appointment date varies due to high mental health demands and the more specific needs one may have. Therefore, we cannot provide an average time frame as there are many variables to consider. This includes requests for in-person versus virtual, specific days of the week and times, specific type of counselors, specific demographic requests. This is no different than when you are waiting for a specialist to be seen, such as an endocrinologist or a neurologist. Lastly, we have moved the EAP brochures and EAP orientations to their own tile, placing all EAP promotional items in one section. Next slide, please. Now that we have reviewed this year's updates, I want to give you a small glimpse of what to come in fiscal year 2025. For our customer partners who have the bundle EAP and work-life services, an all-inclusive EAP and work-life monthly newsletter will be delivered 15 days before the beginning of the month. The first quarter EAP utilization report will be modernized with a new look that is easier to read. These 2 updates will occur in January of 2025. We have updated some of our processes to provide a more customer-centric approach. One item is the EAP Health and Wellness presentation and work-life presentations. All requests must go through your account executive. We want to make sure you are getting the right presentation for your agency. This will also allow us to help keep you on track on your allotted webinars for the year. No one likes surprises when you think you have something available and you don't. We want to be proactive. This brings me to some reminders. To ensure that we can verify your employees with your agency, please remind your employees to identify as the agency name provided on the agreement when calling the National Care Center. If a customer calls with an office name, it just can delay the verification process. Your account executive is more than happy to provide the agency identifier as we understand staff changes and this information may have gotten lost. Your account executive has already reached out to see if you're maintaining the current services. They have also requested you to share any updates to your agency point of contact list as well as provide us the number of extra webinars you would like to add to your fiscal 25 agreements. For those who have emergency backup dependent care, the number of visits you are requesting this year is needed. I want to add BHS was very proactive in setting a deadline of June 1st for modifications so that we can ensure visits were funded before the peak came. The key is being proactive. As you formalize the number of visits for 25, look at your trend data and talk with your account executive for the best estimate for this upcoming year. This is also a time to upgrade services with us. So if you have EAP only, you can add work-life services. And all those who have work-life services, you can add emergency backup dependent care services. Please note you can only have emergency backup dependent care service with our work-life plan. We thank you all who have submitted the requested data, as this allows us to get your agreements to you timely. This is also a reminder to read your agreements when you receive it. We have provided some updates to the description of service, also referred as the DOS, and we want everyone to be well informed. When you have updates regarding your agreements, please include your account executive on the emails that are sent to our finance team. This allows us to help you get everything you need in a timely manner. To make sure you are successful in administering your EAP and work-life program, we are updating the administrator guide we provided last year to you. This guide provides all of our services, including all the new enhancements and processes, so that you have a convenient reference guide to assist you in your everyday operations. Lastly, the monthly campaign calendar is distributed in the month of December. This will help you plan your 2025 calendar year of events. We look forward to our continued partnership with you. And for those who currently do not have FOH EAP and work-life services, I hope I have piqued your interest. I will now hand this call over to Keith Kirkpatrick from the Environmental Health and Safety Services.
Hi, thanks so much, Betsy, and hello, everyone. Again, my name is Keith Kilpatrick, and I'm the Service Director for Environmental Health and Safety Services. As you well may know, federal agencies are required to have measures in place to protect the environment and employees from workplace hazards. Well, these requirements often are associated with citations and penalties for noncompliance. So when achieving compliance requires specialized experience, accreditation, and or certifications, agencies often lack the ability to effectively address some of those mandates. But within FOH, Federal Occupational Health, EHS has subject matter experts that can provide the professional support needed to eliminate, mitigate, or even control hazards, as well as develop a geographically site-specific control plan for you. Our comprehensive evaluations include services such as indoor air quality, mold assessments, respiratory protection, ergonomics, drinking water, and lead evaluations, as well as fire protection engineering services. And that's just to name a few, and we continue to grow. Today, we have our newest program manager with us, Lieutenant Commander Richard Dillahunt, who also is a certified industrial hygienist and a subject matter expert in many areas of EHSS. He will be reviewing the dangers of heat exposures for us today. So at this time, I would like to introduce Lieutenant Commander Richard Dillahunt. Richard?
Thank you, Mr. Kilpatrick, and hello, everyone. Again, my name is Richard Dillahunt, and I'm a program manager with Environmental Health and Safety Services. It is my pleasure to speak with you today about how EHS is reducing heat stress-related illnesses across the federal workforce and how our experts can help you do the same. Most states are experiencing an unprecedented heat wave, and the United States is on track for the hottest summers on record in 2024. Heat is a well-known and recognized occupational hazard for outdoor and indoor workers, that can cause serious and fatal illness when they are not provided the necessary protections and training. Each year, thousands of workers become sick from occupational heat exposure, and too many of those illnesses result in fatalities. New employees whose bodies have not had time to adjust to working in the heat are the most vulnerable. Nearly 3 out of 4 workers who die from heat-related illness causes die in their first week on the job. First, I would like to define a few key terms for you. Heat stress is the net heat load to which a worker may be exposed from the combined effects of metabolic heat, environmental factors, and clothing requirements. As heat stress increases and approaches the upper limit of heat tolerance, further increases may lead to an unacceptable heat strain and the possibility of heat-related disorders. Heat strain is the physiological response resulting from heat stress. Normal physiological responses are dedicated to dissipating excess heat from the body. When these normal responses are no longer adequate, excessive heat strain may result and lead to heat-related illness. Heat-related illness is a serious medical condition resulting from the body's inability to dissipate excess heat load and includes heat cramps, heat exhaustion, heat syncope, and heat stroke. Next slide, please. In April 2002, OSHA initiated a national emphasis program on heat-related stress and continues to focus enforcement efforts in geographic areas and industries with the most vulnerable workers. OSHA has been conducting outreach to remind employees and employers of their responsibility to protect workers from heat exposure and has been using its enforcement resources to hold organizations accountable if they fail to provide a safe working environment. This has become a priority for OSHA due to the record-breaking temperatures in the United States in the summer months. OSHA area offices are performing heat-related inspections at facilities on days when the heat index is expected to be higher than 80 degrees Fahrenheit and on any day that the National Weather Service has announced a heat warning or advisory for the local area. During heat-related inspections, OSHA will review OSHA 300 incident reports for any entries indicating heat-related illnesses, records of heat-related emergency room visits and/or ambulance transport. They will interview workers for symptoms of headache, dizziness, fainting, dehydration, or other indications that may indicate heat-related illness, including both new employees and any employees who have recently returned to work. They will determine if the employer has a heat-related illness and injury program addressing heat exposure. And they will also observe and document conditions relevant to heat-related hazards and identify activities relevant to heat-related hazards. On April 24th, 2024, the U.S. Occupational Safety and Health Administration announced that it has moved closer to publishing a proposed rule to offer greater workplace heat protections to employees in both outdoor and indoor settings. The Assistant OSHA Secretary has stated that workers at risk of heat-related illness need a new rule to protect workers from heat hazards. OSHA is working aggressively to develop a new regulation that keeps workers safe from the dangers of heat. OSHA performs compliance visits at federal facilities, and you can receive a notice of violation for an unsafe or unhealthful workplace condition if found. Next slide, please. Now let's discuss how environmental health and safety services can assist you with heat stress management in your organization. We develop heat illness and injury trainings that provide verbal and written instructions for annual training programs, define heat stress and strain, how to avoid heat-related illnesses by recognizing and mitigating situations that may lead to disorders, and emergency response plans in a language and format that is understood by workers and supervisors. We can also revise and develop your organization's current heat stress management plan to ensure it includes heat stress hygiene practices such as fluid replacement, appropriate work and rest ratios, and heat acclimation procedures, which is the physiological adaptation that improves a person's ability to tolerate heat stress. We also offer on-site assessment of work practices, including environmental monitoring, which incorporates humidity, ambient air temperature, radiant heat, and wind speed, and heat strain physiological monitoring, which measures heart rate and core temperatures to recommend specific controls such as cooling vests, reflective shields to block radiant heat, increase ventilation, and work rest schedule development. Please contact Environmental Health and Safety Services to help you protect your workforce from heat-related illnesses and injuries during this record-breaking heat wave. For more information on Environmental Health and Safety Services, please contact me at 771-233-5948, and I will be happy to assist. At this point, I would like to turn the presentation over to Mr. John King, who serves as the Director of Wellness and Health Promotion Services. Thank you.
Thank you, Richard, and good morning, everyone. I'm John King, Director of Wellness and Health Promotion Services, commonly known as WHIPS. As you know, WHIPS is a service line within FOH. We provide comprehensive and integrated wellness services for federal employees and their agencies. Our programs are designed to support and sustain a culture of wellness for participating federal agencies. Our services include fitness center management, on-site and virtual health coaching, nutrition counseling, wellness programs, and fitness classes, along with an online wellness portal for federal employees. At WHIPS, we view employee wellness as a long-term 360-degree commitment that helps participants develop skills to make healthy choices and improve their health year after year. Our services help create an engaged and energized workforce, improves employee morale, productivity, and job satisfaction, and it keeps healthy employees at low risk by promoting health maintenance and supports behavioral change for employees at moderate and high risk. Services can be delivered on site, in person, and virtually across an agency's entire workforce population. We provide a suite of wellness and health promotion services, which includes expert consultation, program design and delivery, along with review and monitoring. Next slide, please. WHIPS is pleased to share with you some new services. WHIPS can now implement fitness assessments at our sites. Fitness assessments assist with goal setting, fitness priorities, and include post-assessments to monitor progress. Our fitness assessments can capture one's current status in body composition, cardiovascular fitness, flexibility, muscular strength, and muscular endurance. Our testing methods use validated instruction and scoring procedures from credible organizations, including the American Council on Exercise and the American College of Sports Medicine. Scores are applied to interpretation tables that can be further explained by our fitness specialist staff. Based on those scores, our staff can make recommendations for preferred equipment and/or exercise classes to maintain or improve each fitness component. The fitness assessment program draws people to our fitness centers, provides individual data and tailored recommendations, and promotes existing equipment and programs. Aggregate data can be used to shape fitness center programming. For example, data showing poor flexibility among employees may lead to more yoga or Pilates classes, workshops to address lower back pain, mediation strategies, and content in our newsletters to explain the benefits of flexibility training. Next slide, please. Our universal schedule continues to be a successful program with over 40 live fitness classes taught Monday through Friday. In Q4, we added Les Mills Strength Development, a progressive strength training class designed to build muscle, improve techniques, and grow confidence in weight training. The class is suitable for all fitness abilities, however, may be of particular interest to those new to strength training. Unique to this format is that moves are not set to music beats, which may appeal to participants new to group fitness. Recalling the fitness assessment slide I discussed earlier, Strength development would be a logical format for an individual that received average or below average scores for muscular strength or muscular endurance, as this class is designed to make you stronger by week 12. And we're excited to connect our programs together to offer more value-added services to our members. Next slide, please. WIPS offers virtual live group exercises with a wide variety of formats, including cardio, strength, dance, flexibility, meditation, and they're certified instructors in several specialty formats, including yoga, Zumba, and Les Mills. There are 40+ classes per week. Classes are available Monday through Friday with morning, midday, afternoon, and evening options. And the times range from 20 to 45 minutes. And we have monitoring and reporting capabilities. If you would like to add WIP services or have any questions or want to learn more about our services, please don't hesitate to contact us. Next, I would like to turn the program over to our Clinical Services Director, Dr. Jenny Bamalu.
Thank you, John. Hello, all, and greetings from the Clinical Health Services team. Since the last customer call, CHS has made some significant changes to our leadership team. Aviva Walker-Sicard is our new Chief of Business Operations and Customer Engagement. Dr. Andrew Kim recently joined FOH as the new CHS Medical Director, and Tabitha Palm is serving as the Acting Chief of Clinics. In April, CHS held a town hall to review the service mission, vision, core values, policy updates, and the FY 2025 flu program. We had 134 participants on the call, including many of you, our customer partners. CHS also held a customer call on May 7th. During this session, we reviewed the account executive role in interagency agreements, the process for requesting appointments, the medical clearance and exam process requirements, and records management. We had 74 participants on this call. CHS will hold its next customer call in October and appreciate you submitting questions in advance. This allows the team to investigate each question thoroughly and respond intelligently. Next slide. CHS has updated the influenza program to focus on actual utilization and agency needs. In March, you should have received communication from your account executive asking for the number of doses needed for this flu season. Agencies were asked to review previous year's utilization before submitting FY25 requests, as refunds will not be issued for unused vaccine due to their limited shelf life. The flu program is subject to the availability of the flu vaccine. Services will be billed based on the number of vaccine requested. We're working to ensure the procurement and distribution of the vaccine orders before the start of the flu season. Please follow up with your CHS account team if your agency has not already submitted your vaccine request. Regarding agency examination forms, FOH would like to ensure that we have the most up-to-date version of the agency exam forms. Agencies were asked to provide the most up-to-date version of the exam forms in digital PDF fillable format by September 30th, 2024. Forms should be sent to CHS customer service at psc.hhs.gov. Updated versions of the exam forms will be accepted annually, as all agency forms require approval by the FOH medical leadership. Notification will go out with a reminder of the window of approved time to submit updates to your medical forms. Changes requested during the year outside of this window will be evaluated on a case-by-case basis. I will now hand it over to Mr. Christopher DeWitt, our CHS Deputy Director, to review the annual end-of-year closeout. Next slide.
Good afternoon. My name is Christopher DeWitt. I am the Deputy Director for Clinical Health Services. Today, I would like to talk to you about our annual end-of-the-year closeout. Each year, FOH is required to pause routine incumbent medical clearance and surveillance examinations to close out our fiscal year. Incumbent exams are our annual exams conducted for current employees. These are your current employees that are currently working in your agency right now. During the closeout period, we do not conduct incumbent medical clearance and surveillance examination to focus on billing and closing out the fiscal year. For example, this year we will be closing out, having this time in August of this year to close out the fiscal year for fiscal year 24, going into fiscal year 25. The last day to contact our occupational health clinic directly to schedule an incumbent examination appointment or email the FOH scheduling mailbox to request an appointment through our FOH provider network. This is our private provider network, will be August the 5th. For example, so as I mentioned, the last day to schedule an appointment for an exam is August the 5th. The last day for incumbent employees to receive a medical clearance or surveillance examination in one of our clinics or either through our provider network is August the 19th. So those are two very important days for you to remember. August the 5th is the day you need to make your appointment and schedule your appointment by, and August the 19th is the last day you will receive an exam. It is recommended that all agencies request incumbent employees to contact one of our clinics or either schedule through our FOH scheduling mailbox, which is for the by August the 5th. To schedule through our private network, please email FOH scheduling or either contact the agency directly. So if there comes a situation where you have a mission critical exception, where you really need us to pay close attention to help you get an exam done immediately, you can make an exception of policy, right? An exception, a mission critical exception. If you need to do so, please email our customer service box. That is CHS customer service at psc.hhs.gov. Please note that all applicant or state exams are excluded from the closeout. These examinations will continue to schedule. I am referring to those exams that are required before an applicant can be hired at your agency. Next, I will hand it over to Catherine Chen, our Director of Operations and Management. Thank you.
Thanks, Chris. Good morning, everyone. I'm Catherine Chen, Director of Operations and Management. Thanks to all of our customer agencies for your partnership and cooperation this year as FOH transitioned to the new G-invoicing system. As of the end of third quarter, we have successfully executed over 90% of our reimbursable agreements in FY24. And we are continuing to work with customers that still have funding orders that need to be processed to ensure that they're fully signed and executed prior to our agency's July 31 deadline. We understand that some agencies are still dealing with G-invoicing implementation delays or are working through system challenges that may be impacting your ability to finalize agreements. Some of these system challenges may be internal to your agency, but we're also aware that there are technical issues that FOH is also working to resolve on our end. For this reason, we did extend due dates for certain customers, and in some cases, we have had to temporarily suspend services till we received funding orders. We want to make sure that we support our customers in getting these agreements completed, and will accept forms outside of the system so that we can meet these deadlines. Given we're 2 months away from year end, we urge affected agencies to work with your FOH account analysts to finalize agreements, and if necessary, to provide us with a signed PDF 7600 A and B form as soon as possible if system challenges won't be resolved soon to allow processing in G-invoicing. Our goal is to get these outstanding current year agreements executed no later than the end of this month, as we'll soon be directing our focus to the preparation and rollout of FY25 agreements. We will need all outstanding current year agreements back from the customer, fully signed and executed before we establish agreements for next year's services. As a reminder, modifications to add additional services to existing agreements must also be received by FOH no later than the end of this month to ensure sufficient time to execute before year end. The FOH team is monitoring customer utilization and burn rates and will be reaching out to your agency if adjustments to funding lines or additional funding is required to complete billing. As you know, we are a reimbursable agency that relies on federal customers to fully fund and reimburse FOH for services received, and we're unable to continue services and to bill and recover costs without a complete signed funding order at the beginning of the fiscal year. So we are beginning the process early, a few months early this year. FOH will be kicking off the FY25 agreements process this month with the dissemination of GT&Cs or 7600As in the G-invoicing system beginning this week, followed by funding orders in early October with the goal to execute all agreements by November. GT&Cs or 7600As will be going out beginning today, July 24th, after this call, on a rolling basis with the goal to have all agreements to customers before year end. All GT&Cs are due back to FOH within 10 business days of customer receipt. Timely return of the GT&C is needed for FOH to project customer demand, and it informs our agency of the volume of services that we'll be providing next year. Based on customer feedback we received this year, we have made some changes to the process. In FY25, with some exceptions, FOH will be initiating both the 7600A and B. We are hopeful this will reduce the number of rejections and mitigate the back and forth that we experienced this year on finalizing agreements. As I said, there may be some exceptions needed by certain customers. For example, customers that have existing multi-year agreements that have not expired may continue to initiate their funding orders to avoid having to recreate the 7600As that are already in place. 7600Bs or funding orders will be initiated in early October as soon as our financial system opens up for the new fiscal year. We expect that to be sometime in the first or second week of October. We ask that customers return the funding orders within 10 business days of receipt. We understand that agencies may not be able to fully fund their agreements in the event of a continuing resolution. However, a funding order is still required for FOH to continue providing services, as the budget authority we have to operate at the start of the fiscal year is contingent on the agreements that we have in place. To ensure customers don't experience any interruptions or suspension of services, initial orders may be funded in accordance with CR guidance. And our agreements team will then work with you to process modifications if needed to fully fund agreements within 10 business days of enactment of appropriations. Next slide, please. For any questions that you have regarding your agreements, billing, deobligation requests, or general questions about the timeline or process, continue to reach out to us through our 2 main resource mailboxes shown on this slide. Your agency can, of course, always reach out to your analyst directly and or contact our agreements branch chief, Gwendolyn Lennon, for any urgent requests. We appreciate everyone sending us your updates on your agency point of contact information so that we can keep a complete and current customer listing on file. We will be sending out a copy to everyone after this call. Please notify us if you have any updates that are needed for FY25. Thanks to everyone for your time. We look forward to working together in FY25. And please don't hesitate to reach out to our team if you have any questions that we can't answer on today's call. I will now turn this back over to our director, Dr. Robinson.
Leadership team for sharing information and providing updates of what's going on in their specific service areas. So thanks again for that. So our FOH customer partners. So what I would like to do is take a moment to let you know what's going on, what I like to call FOH's world. So we've had a lot of transition. We've had a lot of things going on with our budget. We have a lot of challenges with our records management and access, and also just trying to make sure we answer and respond to your constructive feedback. So first, let's talk about our employee transitions. As you learned today, there was a change in our PSC leadership. Mr. Pat Hernandez and Mr. Mike Saunders, the RLO director, both moved on to new and promising positions. And so now we have Melissa Bruce and Connie Yates who have joined our team. We finally got a deputy director, which was vacant for several years. So we're excited about them joining. They have hit the ground running, and I'm excited about where they want to take this organization. So thank you guys, Connie and Melissa, for taking time to join us today. I also want to inform you that FOH2 has had a significant amount of employee transition and turnover. We are proud of our FOH team members who have been promoted and also moved on to other promising opportunities. So we wanted to thank them for what they've done for FOH. But what this means is that we have lost a significant core of our expertise and experienced personnel in some of our main and core functions. So we're working hard to get these positions filled as soon as possible. So we ask you to be a little patient with us and give us a little grace as we work through this hiring process, because I know you probably experienced what we do of getting people hired. It's a challenge sometimes, but things are moving faster and we hope to have people hired sooner than later. So we ask for your patience and grace as we continue to work through this process and to continue to provide services. So we hope that we're not, impacting the amount of services that we're able to do because of these transitions of our employees. So again, thank you in advance for your support and patience as we work through that. Secondly, just a big part of what's been going on for the last several months is that we've been deep in our budget and financial operation processes. We're working through concluding our FY 2026 formulation process, where we identify financial resources we need to continue to provide services in FY 26. So we are concluding 24, but we've already thinking about what we're going to do in 26. Now, as part of our effort to improve our systems and our processes, we have requested additional funding in FY 26 to invest in FOH modernization and innovation initiatives. So this request is still under considerations, fingers crossed, and we're hopeful that they will give us something so we can update a lot of our antiquated and legacy systems. And as Catherine and part of the other team has talked about, we are preparing for FY 25. We are anticipating a zero-based budget review with our new PSC director next week. So we're going to look at what our program is and make sure that we're being and executing our program in the most efficient and effective manner. Also, Catherine informed you that we are kicking off our FY 25 IAA process and cycle starting today. So again, we ask that you return these 76 A's back to us within 10 business days of receipt or sooner, because this gives us leverage of what we can ask for or what they give us to kick off the beginning of the fiscal year. So again, please support us in doing this, and then hopefully this process continues to be improved and work smoother each year that we push this out. And of course, we need you to help us properly close out FY 24. Again, meet these deadlines that were described definitely by BHS and IAA so that we can make sure that we close out 25, we're able to close out 24, and we're able to start off 25 with no challenges. So I want to thank you in advance for helping us support us to do this, closing out 24, getting ready for 25, and projecting what we need for FY 26. As I say, we have a lot going on with our budget cycle. And I also would like to provide an update on our records access and management. Now, as of date, we have not heard from OPM about how the agencies are supposed to dispose of records. And once we get this information, we will ensure that this process to dispose of records are followed accordingly. And also, we've been receiving a significant and a large amount of requests from agencies for batch copies of their agency records. And as I've discovered, and I know I've been meeting with several agencies, unfortunately, our systems do not have the capability to process these types of requests at this time. So additionally, we have lost, like I said, significant amount of staff, and a lot of our staff used to help us with this record pools and helping us to capture these records to provide to you. So additionally, we ask again for your patience and your grace as we work through trying to process your records requests and work with these agencies to get you what you need. We are trying to figure out how to digitize our records and also trying to find a way to find funding to invest in a records management system. And these are some of the initiatives that we're looking for. Hopefully the funding that we asked for in 26 we're able to get so that we can do these things for you. So again, thanks for your patience as we work through this process. Again, continue to reach out to us and we will figure out what we can do to kind of help you along that matter. I also would like to thank you for providing constructive feedback. As we sent out the responses to a lot of the questions that you asked during the last customer call, and also things that you sent in later. So hopefully they were sufficiently, or your questions or comments were sufficiently answered. We do try to take those comments, the FOH leadership team, we're trying to make sure we incorporate that into our process improvements. So continue to send those questions in, or if you have input or comments, or you need some assistance, please feel free to reach out to us. I hope your customer experience is improving and that you feel valued when you contact FOH and our team. And lastly, as part of our quest to rebrand FOH and move us into the 21st century, we stood up this group that I affectionately call the FOH Team of Champions. And I have this group and put this group together to help me and help us develop this strategic roadmap for the FOH Iconic program. And I would describe this a little later in my presentation. Next slide, please. So the strategic team of champions that I brought together is kind of made up of this cross-functional team from FOH service areas with different perspectives, different levels of experience in FOH's organizational culture and operation. I mean, this team has been meeting bi-weekly for the last several months, and we've been assessing our current operation and challenges, but we are also looking at how we can build upon what we do well. So our ultimate goal is to develop this strategic roadmap that we call Iconic Project, Iconic 2030. This will allow us to define and lay out our roadmap for our plans for the next 12 months, the next 18 months, 3 years, and 5 years. We're trying to define what we would like to look like, and what we're striving to be. Next slide. So these are the team members who make up this team of champions. I ask you, please feel free, if you work with them already or you want to work with them, reach out to them and let the members of this team know if you have any input, ideas, suggestions, things you want us to make sure we're looking into or considering as we develop this strategic roadmap. We're trying to build this so that we can make sure not only take care and improve FOH operations, but make sure that we're doing what you need and we're providing your expectation and meeting your expectations out there too as our customer partners. So please, here's our team of champions. Again, please feel free to reach out to them and provide any comments, input, or suggestions. And even if you want to provide or participate, we may be reaching out to some of you guys to get your input and be a part of this, developing the strategic roadmap in the near future. Next slide. So as part of building this strategic roadmap, in our quest to rebrand FOH, the team of champions decided to start at the beginning. We were trying to get back to basics. And when you go back to basics, you got to define, who are we? So we started talking about our purpose, like why do we exist? Our mission, like what do we do? What are our responsibilities? We're talking about our values. What is important and defines us? Our business principles, like how do we do what we do? Okay, what guidelines and what guides our operations? We're talking about our promises, our commitment to not only our fellow FOH employees, but also our commitment to you, our customer partners that we serve. So we're looking at all of this, making sure we incorporate this. We're looking at our current mission statement, our value statement. Is it still current? Does it need to be upgraded? You know, based on your feedback and the needs and where we're going and where occupational health services are going, are we competitive in this market? So this is what we're trying to do. We're trying to find who we are, who we believe we're to be, and who we believe we need to be. And so the next discussion, and with this team, we came up with this moniker. We decided we're going to strive to be iconic. Next slide, please. So what is iconic? So we took the letters of the word iconic and we said, we want to make sure we're looking at being and looking at innovation and modernization at FOH. We want to leverage our existing and emerging tools. We want to look at technologies, best practices, data that's available to optimize our service delivery. We're trying to drive efficiencies and effectiveness and to meet the evolving needs of you, our customer partners. When we looked at the C, in Iconic, we were talking about our customer partner experience. We had you in mind when we were thinking about this. We were talking about promoting and delivering valuable and high quality customer centric occupational health services. And we're trying to consistently meet the needs and exceed your expectations. As far as the O, we were talking about our operational excellence. We want to make sure that we are investing in FOH and that the services we provide are top notch and excellent in everything we do. We're trying to drive the highest standards of performance built on organizational culture that values collaboration. We're trying to make sure we're looking at continuous improvement opportunities, and we're trying to optimize business practices and systems to increase efficiencies. When we were talking about the N in our Iconic, we were talking about navigation. We're trying to capitalize on clearly defined tools and deliberate communications. We're trying to alleviate any barriers and enable you, our customer partners, to move seamlessly from one service experience to another when you're working with FOH. We talked about integrity, making sure that we're fostering an environment of respect, an environment of trust, inclusiveness, pride, and ethical behavior that's meeting our commitments to our customer partners and to ourselves. And lastly, we were talking about C, our commitment. We're talking about upholding a shared promise to our FOH team for professional and organizational growth and to our customer partners in their efforts to support employee health, safety, and productivity. This is who FOH is striving to be. We are striving to be iconic, innovative, customer-centric, operating operational excellence, navigation where you can deal with us and have deliberate communications, have integrity, and then looking at someone who's committed to providing the best services that we can to our FOH staff and to you, our customer services. So I would turn it back over to Ronnie, and she will facilitate the questions and answer session at this point.
Thank you, Dr. Robinson. Iconic. I think that's fantastic. And I hope that our customer partners can feel kind of the energy and align with the direction in which we're trying to take the FOH organization. Next slide, please. The chat is now being enabled for all of you who may have some questions with the question and answer portion. Please enter your questions into the chat at this time. We're going to make every effort to address as many questions as we can prior to the close of today's call. Should we not get to your question, we will address it offline and include the responses with all question responses that will be sent after the meeting. When you registered for today's call, you were invited to submit questions in advance, which some of you elected to do. I think we'll start with or open with those questions now and respond to those. So the first question received in advance was a question that looks like to be for CHS. How can agencies receive usage reports from the clinical services team? And I think I'll turn that over to Dr. Jenny to provide a response for us. Dr. Jenny, can you assist with this one?
Yes, thank you, Ronnie, and thank you for this question. Agencies seeking utilization reports can reach out to the fiscal team for a detailed activity report to accompany your invoice. Additionally, CHS provides a charge summary and utilization report for those agencies that have reached 70% of their allocated funding. However, agencies may also contact your CHS account team for utilization reports as needed. Thank you.
Thank you, Dr. Jenny. It looks like your Clinical Health Services is getting quite a few questions to kick off. The next question appears to be for you as well. And that question is, why did FOH change their flu order vaccination process?
Sure, thank you. So CHS updated the influenza program business model after the pandemic in line with the new telework and remote posture of many agencies across the nation. So between 2020 and 2021, we experienced an 82.5% decrease in the number of flu vaccines doses administered. This led to significant waste of vaccines. We continue to see a steady decline year after year. This new business model allows FOH to reduce waste and provide targeted services in line with agency needs. So again, as I mentioned earlier in the presentation, in March, agencies should have received communication from the account executives asking for the number of doses needed for this flu season. Agencies were asked to review previous year's utilization before submitting the FY25 requests. Please follow up with your CHS account team if your agency has not already submitted your vaccine request. And thank you for this question.
Thank you, Dr. Jenny. We have another question here, and it appears to be a question for our fiscal or finance team. How soon will FOH finalize pricing so the agencies can get prepared earlier this year? Has FOH begun the FY pricing? Is FY working on a process to get pricing out to agencies earlier? And I think the answer to all of those is yes. FOH's goal this year was to begin the agreement process earlier. As you heard today from both Kristen and Dr. Robinson, IAAs will begin to roll out this week. And we're asking that once you receive your documents, you review them, execute them, and get them back to us within 10 days. Order pricing will be included in the IAA packages if you haven't received it already. FOH is requesting the return again within 10 business days. This is necessary for us to plan, and execute our services timely and appropriately to all of you. Okay, we have another question here. And this one appears to be for the Behavioral Health Services team. Can someone speak to the response times when employees reach out for help and verify that they're getting connected with a counselor who's available and receiving new clients? This sounds like an employee assistance program question. Can I turn this over to Amy Williamson, the Deputy Director there?
Absolutely. Thank you very much, Ronnie. This is Amy Williamson. Our goal is to schedule an employee with someone when they are on the phone. If an appointment is not available, an employee can view our counselors online and reach out to them or request an appointment search. Appointment searches can take up to 1 week, as previously mentioned by our director, Dr. Betsy Emelian. Thank you.
Thank you, Amy. And we have another question here. This may be for IT. Has FOH considered a Relay Health or online portal for federal employees to view their lab tests, vaccinations, and perhaps audiograms? Something more timely is being requested.
Good afternoon. Thanks, Ronnie. This is Tia Harrison, Chief Technology Officer for FOH, and I'd like to thank you for the question. As FOH defines our IT modernization posture, all of our technology needs are priority. We are reviewing several tools to see how we can enhance the customer experience. So thank you for alerting my team to the Relay Health tool. We will add it to our list of interest and technology tools for consideration. We will also be announcing some enhancements later on in the hopefully FY25, but we encourage our partners to continue to share tools for our consideration so that we are in line with meeting your needs, modernizing our technology, and enhancing the customer experience.
Thank you, Tia. Okay, it seems like the questions are flowing in now. This next question seems to be for Behavioral Health Services. How and when are the EAP satisfaction surveys administered? Can sites receive site-specific satisfaction results? And then there appears to be a second part to this question as it relates to utilization data. The HR dashboard for Work Life for You is available, but it's not, the data isn't being reflected. When can we expect to be able to obtain utilization data through the HR dashboard?
This is Amy Williamson again from Behavioral Health Services. Our satisfaction surveys are provided by a QR code after a presentation and after a counseling case is closed. The QR code is also available in the signature block of our field consultants. Because the surveys are anonymous, we are unable to track responses by agency. With regard to questions around your HR dashboard for utilization information, please contact your BHS account executive and they'd be happy to assist you in accessing your utilization information. Thank you. Turning it back to you, Ronnie.
Thanks, Amy. We're moving right along here, folks. This next question appears to be another one for clinical health services. We've been having some difficulties with getting our exams wrapped up by the MRO on time within 30 days. Is it possible to get a solution for this? And I'd like to just turn this over to Aviva for a response, if I could. The response reads that there's a 30-day clock begins once the examination packet is completed and provided to the RMO. However, the RMO requests follow-up information from the examinee. Once the additional information is received, the 30-day clock restarts. Agencies may reach out to your CHS account team regarding specific examinations that require expedited review. So 30 days is the standard. If there's missing information, the clock restarts. And if you have more specific or detailed questions, please reach out to your clinical health services account management team. Next question. We've been seeing a large increase in exam component prices year over year. Is it possible for us to receive info on future changes in pricing before October rolls around? This appears to be for clinical health services. And I think we covered this when we were in the presentation from the fiscal representatives or the business operations team. Their interagency agreement process is scheduled to occur early this year. We're going to begin rolling out IAAs this week. This should allow customers sufficient time to review and provide signatures. Agreements will be issued on a rolling basis, so we'll start this week, but the process will be ongoing. And the FY25 pricing is included in those packages. The next question, if we've not been contacted about our flu vaccination needs for FY25, who can we contact about this? And we encourage you to please reach out to your clinical health services account team if your agency has not yet received a flu request packet. And then that is the customer mailbox is CHS customer service at psc.hhs.gov. Again, CHS customer service at psc.hhs.gov. Next question. I'm sorry. Will you send incoming exams from August 19th through September 30th? The answer here is examinations in progress will continue to be processed to include the RMO review and determination. Do the exams include RA requests? We'll follow up on that question. Last year, they were bundling the flu shots, and are we doing the same this year? Our clinical health services account management team is the resource for that. So you may reach out to them on CHS customer service at psc.hhs.gov. Going through the questions. Some of these are duplicates, so please bear with me. Can the FedStrive webinar calendar for the year be distributed at one time, just as received them, just in a similar way we received the EAP and Work Life? This calendar is, John, do you want to take that one?
Which one is that?
I can go for it. This is the FedStrive webinar calendar for the year is being distributed.
Oh, yes. Yes, I can answer that.
Thank you, John.
So the calendar is actually prepared monthly based on current trends and most recently requested programs or topics. So since it changes monthly, we could not send it out on a yearly basis.
Thank you. FOH says they are trying to be proactive and process the FY25 interagency agreements early. Does this include the orders also? Yes, that's correct. FY25 orders cannot be processed in FOH internal systems until mid-October. This system will accept your order so it can be processed first once our system opens up. And I think that deadline or that time frame was given was the first or second week of October. How are we doing on time, Dr. Robinson? Okay.
You're okay. We can take a few more.
Okay, thank you. More questions about interagency agreements, pricing? There's a question here as it relates to the GT&Cs and HS requests for seller facilitated orders. If that's your question, please send that question to Gwendolyn Lennon, the agreements team branch chief, gwendolyn.lennon@foh.hhs.gov, and she can assist you with the seller facilitated orders. We're slowing down a bit.
Yes, we will be sending out the slides in the responses to the questions. And then thank you, Jonathan. We definitely will reach out to you about our records and digitization of our records. So we'll have our team get with you. But thank you for the offering to help and provide assistance with that. Did we answer stuff about the COVID bundling real quick? Did we do that, Dr. Jenny, or flu and COVID?
Yeah, we do not offer the COVID vaccine at this time. Right now, we're offering the flu vaccine. And so that's something we can consult with our medical leadership team on.
We also have a question on who do we contact to request medical certifications for special accommodations. And these requests regarding medical employability and reasonable accommodation should be submitted to the CHS account team.
Ronnie, I think we have time for maybe one or two more if we want to.
Okay.
Go ahead.
All right, I think we might be at a stopping point, Dr. Robinson. Again, we want to thank you for all your questions and feedback. Remember, if we did not get to your question during today's call, the responses along with those provided here will be included in the follow-up email that will be delivered to all registrants. The post-meeting email will include all the materials from today's meeting, and that's a copy of the slide deck, the questions and responses, and a link to the YouTube materials from today and transcripts. Following Dr. Robinson's closing remarks, please take some time to complete the survey pertaining to today's meeting. It's important for us to hear from you, to know what you appreciated about today's call and what we may improve upon in future meetings. I think those are all the housekeeping items. Dr. Robinson, I'll turn it over to you for the closing remarks.
All right, next slide. So thank you, Ronnie. And again, thank everyone for taking time to join our customer engagement call today. We appreciate the continued opportunity to provide services to you and to partner with you as our customer partners. Again, key milestones that we talked about. We're trying to get these FY25 IAAs out and start this cycle sooner than later. So once you receive it within 10 days or sooner, get those things turned around to us. That would help us again with our funding allocation from here from HHS. We will continue to incorporate your feedback and improve our services and process. So as I said, we do take note to your feedback or your comments and your questions. I saw a few things here about pricing. We'll look into that and see what we can do as that is evolving as part of our operations too. If you have any other topics that you'd like us to consider for future customer calls, please feel free to include that information on the survey that will be provided on the QR code that you will complete shortly. Again, thank you for joining us on this call. We really appreciate you and value your participation in these calls as well as your feedback. We look forward to meeting with you again in our next customer call, which will be scheduled sometime in February 2025. We will be sending out those save the dates as we get that date locked down and confirmed in the future. Again, thank you. And I'm going to turn it back over to Ronnie to see if there's any last minute things we need to do and allow you time to complete the survey. Thanks again for attending today.
Well, this concludes the second of our biannual calls for FY 2024. We want to thank PSC Director Melissa Bruce, FOH Director Sheila Robinson, and all the service directors who participated in today's call. We would also like to again thank you, our customer partners, for your confidence in FOH as your occupational health provider of choice. Just to restate a few of the reminders, the meeting materials will be emailed to you, and that will be inclusive of the PowerPoint presentation, the questions and responses, and the YouTube link and transcript. FOH is also pleased to present you with the FOH resource portal. As Dr. Robinson indicated, we really like to hear from you. We want to hear what we're doing well and any recommendations or suggestions you may have for areas of improvement. So please send that information and any general questions to the FOH resource portal. And that address is fohportal@foh.hhs.gov, reflected here on the slide. And finally, please take a few minutes, as Dr. Robinson indicated, to complete the survey about today's meeting. The QR code is represented here, and I believe we dropped a link into the chat. Thank you so much for your participation today. Thank you for your partnership. And please enjoy the rest of your day.